Hi, everyone. My name is Lily, and I am the Billing and Office Manager here at Community Health Resource Center. Thank you for joining us for the third and final session of our Chronic Kidney Disease and Nutrition series. Today's presentation will start with a focus on sustainable nutrition approaches for CKD, including meal planning and tips for behavior change. In the second half of today's session, we will have a CKD patient, Trisha Johnson, here to share her story with us and discuss the successes and challenges she's had along her journey. I'd like to thank our partner, the National Kidney Foundation, for helping make this series possible. There we go. Before we get started, I'd like to share a little bit about our organization for those that haven't joined our previous sessions or our programs in the past. Community Health Resource Center is a nonprofit organization in San Francisco. We were established nearly 40 years ago by doctors at California Pacific Medical Center to provide resources and care to supplement their work with patients to support their overall health and well-being. Today, we provide four main areas of service. Those are social work or behavioral health, nutrition counseling, community health screenings, and health education. This series is a culmination of two of our areas of service, nutrition and health education. We're excited to have one of our own nutrition providers, Elena Zidaru, leading this series. Elena is a registered dietitian and the director of our nutrition team. She is passionate about working in the outpatient setting and supporting her clients achieve their health goals. She provides individual nutrition counseling for weight loss and disease prevention, but also provides nutrition therapy for people with various medical conditions such as cancer, diabetes, chronic kidney disease, gastrointestinal disorders, cystic fibrosis, and more. Elena also provides nutrition therapy for cancer patients going through chemotherapy at the Brian Hemming Cancer Care Center or radiation treatment at the CPMC Radiation Oncology Department on an as-needed basis. Her goal is to meet her clients where they are in terms of readiness to change and help them set goals that are realistic and achievable to promote self-efficacy in achieving health behavior change. And as a reminder, the information provided in this presentation is for informational purposes only and is not a substitute for professional medical advice. I'd now like to pass it along to Doris Liu from the National Kidney Foundation to share more about their organization.
All right, thank you so much, Lily. Let me just share my screen. So for those of you who are joining us for the first time, I just wanted to share a little bit about the National Kidney Foundation and what we do. My name is Doris Liu. I am the program manager with patient programs with NKF. I am also a kidney patient, having received my kidney transplant 8 years ago. And I can tell you, as a kidney patient, that nutrition and diet played a huge part in my kidney care, including the progression of my kidney disease before my transplant, and even now. So welcome. We have 23 regional offices across the country, and our office covers the California, Nevada, Oregon, and Washington. And a couple of things, resources that I like to share with you. NKF Cares is a patient helpline. It is staffed by trained professionals who can answer all your questions and provide support. NKF Peers connects you one-on-one with someone who has been there. Maybe you want to ask a patient, if kidney disease is silent, how did you find out that you had CKD and what did you do? I myself connect with a couple of patient peers a few times a month, and so I'm happy to share the information that I learn and support those who are going through what I went through. Both the helpline and peer mentor program are available in Spanish as well. And then online communities is a place to ask your questions anonymously and just read what other people are asking and their responses. We also have a kidney learning center, which is free kidney health education courses. There's a range of topics, some of it in video format, also available in Spanish. And there is a good place to learn more about the basics of chronic kidney disease and kidney health. We also have a bunch of kidney webinars for the kidney community, those who want to learn more about it, as well as those who are living with kidney disease. Our next one is coming up in a couple of weeks, a very popular one. We've had a lot of people sign up because they want to learn more about Medicare and end-stage renal disease, which is just a fancy clinical term for kidney failure. This is when you are at CKD stages 4 and 5. So come and join us to learn more about that. We have a special speaker coming to share about that. All my slides will be available for you after. Lily will send them to you, so you will know where to sign up for these programs. NKF hosts kidney walks throughout the country. This event is fun, inspirational, powerful way to show those impacted by kidney disease that they are not alone in their fight. And it was one of my first contacts with the national kidney community. And it was very encouraging for me. So to find the walk closest to you, go to kidneywalk.org. Authors Luncheon is one of our very popular annual events. It's in person in San Francisco. We bring top authors to come and speak about their best-selling books. This luncheon supports the kidney community. And kidney.org is our NKF website, very easy to remember. You can go there. If you're a patient, click on this box, I am a patient, and you can click on whatever topic you're interested in. The diet and nutrition one has lots of information, recipes, tips for how to eat kidney healthy foods. So with that, I'd like to hand it over to Elena.
Thank you, Doris. And welcome back, everyone, for our last class series from the chronic disease and nutrition. Today, I'm excited. We're going to focus on meal planning and getting more into more details about how to put all those recommendations that we talked last week about into practice and into meals. So we're going to get started with the class outline. So we're going to review the recommended diet patterns for CKD. We talked about plant-based last week, and we're going to talk a little bit about different diets. We're going to talk more in detail about how to read the nutrition label, portion sizes, meal planning, and some tips on behavior change, because a lot of times what I'm noticing with my patients is that you kind of get the information, you know what to do, but sometimes it's just hard to implement those changes. And there's some tips there about that. And as Lily mentioned, after my presentation, we'll have a guest speaker, Trisha, to talk about her story. And also I'll be able to, at the end, answer more questions that are left over from the last 2 weeks, and that maybe came through this week too. So we have those two, and we'll have some time for questions. So recommended diet patterns for CKD. Last week we talked more about the plant-based diet, and there are different options. It's a heart healthy diet, a DASH diet, that basically it's that eating plan to lower blood pressure. It stands for Dietary Approaches to Stop Hypertension. Then we talk about Mediterranean diet with the focus on whole grains, vegetables, fruits, legumes, nuts and seeds, and lean meats. Then we have a diabetes-friendly diet that's more like a carbohydrate controlled diet, and this is mainly for people that have CKD but also diabetes. And then the plant-based diets, Plateau, Plafond, which I introduced last week from those more recent studies. Just as a reminder, Plateau stands for plant focused diet with low protein, and the Plafond, it's more plant dominant, low protein for people with CKD and diabetes. So it's a little bit of a version of the Plateau, but for diabetics. And then I know it can be a bit overwhelming, because basically somebody can just look at that and say, wait a minute, which one is the best for a CKD? I have CKD, I don't know. But, those diets, we have different terms. There are a little bit of different variations. But in the end, and just to kind of simplify things, when you look at all those dietary patterns, like what they have in common, they're all plant-based. That means more than half of the nutrients on the plate, when you look at your plate on a regular basis, will come from plant foods. And then, of course, if you have high blood pressure, I would say maybe go with DASH. If you have diabetes, it needs to be a plant-based, but also carb control, because carbohydrates, a lot of carbohydrates are plant-based foods, but that doesn't mean you can eat as many as you want if you have diabetes, because you still need to control your blood sugar. And then also, I know some of you may have CKD because, because maybe you had kidney damage from a lot of kidney stones that your body produces. And, those people, especially with the oxalate, kidney stones, should manage a bit the intake of, the oxalate foods that are high in oxalates. And, you're doing more a plant-based diet, but there are some plant-based foods that are high in oxalate, like spinach, for example, or almonds, or potatoes, or certain leafy greens. So people on a little bit of an oxalate restriction also need to know what are the highest foods in oxalates, and maybe not overdo those. Also having some calcium foods at each meal with oxalate foods, so that the calcium and oxalate can bind and can be eliminated. So there are going to be different ways to individualize this plant-based diet based on what's going on with everybody. Sometimes people have gout and chronic kidney disease, and they need to kind of decrease the purine intake from different foods. And yes, purine foods high in purines are also high in protein a lot of times. So by managing the protein for CKD, it helps, but there are going to be some, some other foods, like, for example, asparagus or beans and peas, that you need to eat a little bit in more portion control because they're high in purines. So there are going to be certain twitches based on what else is going on with your health. There's no one healthy diet that fits everybody. I always tell people, healthy diet, it's what's healthy for you with your medical conditions that you have. And a lot of times, people may need to have an individualized approach, maybe talk with the dietitian one-on-one just to kind of tailor that diet. But I wanted to make it clear that for most of people with CKD, a plant-based, again, it can be a little bit adjusted based on what are conditions, but plant-based, lower protein would be the general kind of message. So the DASH diet, which is the one recommended by the National Kidney Foundation, again, it's very helpful for people that also have hypertension. It's a diet that really focuses on lowering sodium, eating more whole foods, less processed foods, and restaurant eating that will bring a lot of sodium, increasing vegetable and fruit consumption, eating more whole grains, and focusing only in protein foods. So those are the main principles of DASH diet. And then Mediterranean diet, very similar. The base of the pyramid would be those plant-based fruits, the same legumes, whole grains, vegetables, fruits, but also nuts and seeds and olive oil and avocado. So those healthy fats. So there's a more emphasis on healthy fats, and then more emphasis on fish and seafood, at least 2 times per week. We recommend up to 12 ounces in a week. And then moderate portions of poultry, dairy, and less often the red meat and desserts. Then we have this My Plate, which is a good, a lot of people and patients that I have with diabetes use it as a model of eating. Again, that ratio on the plate, when about 75%, 3/4 of your plate will be plant-based, but only 1/4 of a plate your starch, because you're trying to limit the carbohydrate food, regardless if that's mashed potatoes, which would be a starchy vegetable, and this is like a brown rice, which would be a grain. And then you still limit your protein to help you keep the protein low on a CKD diet, and then you have this abundance of vegetables. And this is a little bit redundant. I'll go a little bit faster through those slides, couple of slides that we talked more last week about the evidence on the plant-based diet, but basically there are different diets under that umbrella, and gain more popularity because more research kind of show that, you know, eating those more nutrient-dense foods and more whole foods, less processed, will actually benefit the kidneys. We have here more research findings that basically an overall plant-based diet, it's associated with slower GFR decline, so basically slows the progression of CKD. And the National Kidney Foundation and CDC recommends as being a beneficial diet for kidney health. As I mentioned a little bit last week, and I'll review because it's important, and I know some of you are worried about potassium and phosphorus and those plant-based foods, but the plant-based foods that are not highly processed, such as vegetables, whole grains, nuts, fruits, they have phytates. And those basically, they're actually the phytates, for you that never maybe heard of those, they're just organic acids that store phosphorus in plant foods, plant-based foods, such as grains, nuts, as I said, legumes, veggies. So it's a way that basically the phosphorus is stored in the plant foods, and then because it's combined, a lot of the phosphorus that we eat, that occurs naturally in food and we eat, it's not going to get absorbed very well in your body to really influence your blood levels of phosphorus. So I was mentioning last week that with the plant-based foods, somewhere between 40 to 60% of phosphorus may be absorbed versus animal-based food that's higher, and then the phosphorus phosphate additives that are added to foods, that would be close to 100% rate of absorption. So definitely, you know, the plant-based foods that are high in phosphorus are the ones to go and to eat more, to go for and to eat more often. Now, I wanted to show you a bit more in detail, go into reading the nutrition label. And I know sometimes we don't have the time to spend at the store and peruse everything, but we should definitely be aware more of what's in the food we're purchasing. And the nutrition label and the ingredient list, those two are kind of the ones that I usually go to figure out if it's a product that's good for me or not. So very important few steps here to make it more efficient and to, in few seconds, to be able to decide if this is a good product for me or not. So you look here, what's a serving size? Because a lot of times we look at the numbers first and we forget to check the serving size. And then you assume sometimes that, you know, those numbers are for the whole package or the whole container, but sometimes it's just, you know, part of it. So you want to know how many servings are in the container, how much is the serving size, and realize in your mind, does this make sense? I would eat just a cup of this product in one sitting. Or let's say, how much do I need to eat to get those numbers? Oh, I need to eat half because there are 2 servings in this container. So that will help to put things into perspective, because if you eat more than a serving, you multiply everything by the number of servings you're eating. Or if you eat less, then you divide everything by 2. And then something, a product that maybe is high in sodium, if you divide by 2, it might become moderate or low in sodium, right? So it really makes the serving size makes a difference. So it would be good to be aware from the beginning. Then you want to glance at the calories, especially if your goal is to lose weight, because you want to make sure you understand, is this food a calorie dense food or not? Usually 200, when the food is 250 calories or more, it's a more caloric dense type of food. You want to be, again, more careful with the portion. Then the ones that are here in yellow are the nutrients that you want to limit as much as possible, and the ones that are in blue are the ones that you could have more of. So limit those nutrients. You want to glance at the percentage, and the rule of thumb is that 5% or less will be low and would be ideal because you want to limit those nutrients, and 20% or more is high. So you don't want that for the yellow nutrients, but you want that for maybe fiber here in blue, 20%, because that would mean that food is high in fiber. So 5% or less means low in that nutrient, 20% or more means high in that nutrient. And again, in this particular case, we have 20% for sodium, which means it's high sodium food, and about 15% for saturated fat, which again is not 20 or more, but it's getting closer to 20. This food definitely has a bit more saturated fat. And then it's 0% dietary fiber, which ideally we wanted 20, so we wanted more. So overall, you know, when you glance at those, you could tell like may not be the best choice. Maybe I could find something with less sodium or with more fiber. And, you know, in this particular case, we don't know what this product is, but just we could look at the nutrition label to guide and decide, is this a good food for me or not? Now, on the other side, we have another example, 2/3 of a cup. We have about 8 containers, 8 servings per container. So this may not be as much as a serving of whatever food this is. But in 2/3 of a cup, we have about 160 milligrams of sodium, 7%. So it's not 5% or less, but, you know, it's pretty close. So we can make it work. We have 16% dietary fiber. It's not 20% or more, but, you know, it's getting close. So it has more fiber than this product. And saturated fat, 1 gram, 5%, which is great. So this one definitely will fit the bill much better than this one over here. And this is how sometimes we're making those decisions. And again, if you have CKD, you want to glance at the sodium for sure. You know, it's always good to look at the saturated fat and aim for less dietary fiber, sugars. Especially if you have diabetes, you want to look at the total carbohydrate and sugars, and you want to watch the protein too, right? So kind of be aware how much protein, since we're doing a more lower protein diet. The protein won't have a percentage, is in grams. And I showed you how to calculate the grams of protein you need in a day last week. So if you have a budget for the day, you'll probably gauge if this is a good protein, it's too much, or if it's a good amount to help you keep the protein low. Going back into the sodium more, as I said, 5% or less low sodium, 20 or more high. Usually the low sodium, if you like to look at the milligrams, or your brain works better with the milligrams versus percentage, that would be 140. So whatever, it's 140 milligrams of sodium or less would be that 5% or less, basically equivalent. And then you want to look at the ingredient list too, especially as I mentioned, that would be nice to look for the phosphate additives and identify those. Even though you have the amount of sodium, you want to kind of look at the ingredients list and understand if something has sodium, salt, or soda. All those names basically refer to sodium. And I have here an example, like those are some, again, the ingredient list of a product, and the ones that are underlined are the basically all the ingredients that contribute towards that sodium amount: salt, garlic salt, monosodium glutamate, and sodium citrate. So anything that has salt, soda, or sodium in the name will signal sodium, sorry. I have another, wanted to make a point for certain foods. Sometimes we just say, oh, I cannot have cheese, for example. It's not good. It's high saturated fat. It's high sodium. And I wanted to give you some examples and put it more into perspective of how to balance that diet and the diet choices. So for example, we have this sliced cheese, sharp cheddar. It doesn't seem to be reduced fat or low fat, even though there are options available on the market when you could get less saturated fat. But this one seems to be full fat, 4 grams per one slice, 4 grams of saturated fat, which translates into 20%. So it's high, by definition, high in saturated fat product. Sodium is 136%. It actually should be 5. Sometimes you'll see with the labels, they're not very all the time on the dot. Some of my patients kind of complain about, it's like, well, it should be 5% or less, right? Because 140 or less would be 5%. But sometimes, as I said, if it's like 1% difference, it's not something to worry about. So this would translate into lower sodium, even though it's cheese, and cheese usually tends to have more sodium, depending on the type of cheese. And then we have 5 grams of protein per slice, which, usually in an ounce of cheese or an ounce and a half, you get somewhere between 5 to 7 grams. So that was expected. And then potassium, we have also some labels will list potassium, some not, but this one is 15 milligrams, so not as much at all. And then we have this, frozen meal, cheese lovers lasagna, and this is the nutrition label. 1 cup is a serving, so there are 2 servings per container. So if you eat half, which would be here per serving, you get 290 calories, you get 30% saturated fat, you get 25% sodium, or 570 milligrams. You get 14 grams of protein, and I think we could continue looking at other nutrients, but let's glance at potassium, 510. And if you have the whole package, this would be the numbers, which again, they'll double. 30 calories and 630 calories, 60% saturated fat, 53% sodium, and about a little bit over 1,000 milligrams of potassium. So in general, I say then, a lot of times, obviously this is something that would be high in sodium saturated fat, is also a frozen meal, has other ingredients, has much more cheese than a slice here. And then probably some ground beef and some red meat, so more saturated fat. But overall, I say, cheese, if you consume, you put a slice of cheese on a whole wheat bread type of sandwich with some grilled vegetables, with some pesto sauce or avocado, maybe some arugula, and make that as a meal, that would kind of fit the budget. Won't be that high protein, won't be that high sodium, won't be, high potassium, versus something that, again, it's cheesy, has cheese, and cheese in this particular type of dish may not be that ideal. I have a little bit more information about how to lower sodium in Asian cuisine. This was one of the questions that came through the registration. A lot of you were curious, and I know that can be challenging because with cultural cuisines, and especially Asian cuisine that uses a lot of high sodium sauces such as soy sauce, fish soy sauce, or black bean sauce, oyster sauce, those are high in sodium, but also those give the flavors of that specific cuisine. So without them, you really don't get the full experience. And of course, one of the things that can be done would be to use lower sodium alternatives of soy sauce, fish sauce, and that can help to reduce the sodium. A lot of them, for example, a low sodium sauce will still have quite a bit of sodium per tablespoon per serving. It can be over 200, so consider more high sodium foods, but would save some sodium and will help reduce the amount of sodium in your diet. I teach also my clients to gradually start adding smaller amounts in their food, right? So you allow your taste buds to adjust to less sodium. They're more sensitive to sodium and salt. So if you do it kind of gradually and more in time, the adaptation happens. I had a lot of patients that cut back on, let's say, fast food, which is salty, and after about a month or so, you start noticing that, oh, I don't like as much the saltiness of foods. I'm used with less salt. A lot of them, they say, if I have right now a fast food meal, I feel like it's overly salted and my taste buds feel more overwhelmed. And I wonder how I used to eat so much salt and enjoy it. So definitely the taste buds change and adapt. We change them every 3 weeks. We make new ones. So with whatever dietary changes, if you make them gradually in time, the new ones that you recycle and create each time will actually adjust. I see the same thing with sugar. When you wean off sugar, definitely it's first of all, it's easier because you don't keep craving it. Sugar feeds the dopamine loop, so the more you have it, the more you want to have it. So when you don't have it for a month or so as much, then you're not craving it as much, first. And secondly, again, the level of sweetness changes, and people feel like they don't need to add, for example, as much sugar in their coffee. They're okay. So the adaptation happens, and even when you do a lower sodium alternative, I would still try to work on adding less and less, and allow my taste buds to adjust to that level of saltiness. The flavor of those sauces will still be there. It's just the saltiness that would be different. So also you could use more spices and condiments, right, in your cooking. And we teach our patients that because it really helps to bring more the flavor of the food together. It's garlic or ginger or green onions or cilantro. You know, there are the Sichuan peppercorn or black pepper, white pepper, sesame seeds or sesame oil, which has a very nice toasted nut type of flavor. There are the rice vinegar and the black vinegar, the bullhead barbecue sauce, which is not sweet, and you know, it doesn't have that much sodium actually, but it creates some flavor. And then also, probably you heard, coconut aminos are used as an alternative to soy sauce by a lot of people. Some brands, again, not all of them, but some, they might have 90 milligrams per teaspoon, which would still be, I mean, if you use a tablespoon, it still adds to about 270 milligrams, but would still be maybe about a third or less than the soy sauce. And a lot of people say it's a good flavor, very similar with soy sauce. That's a good alternative. I put here on a website, healthymissiondietitian.com, that she is an Asian dietitian that has good information on her website and some good blogs, and very passionate about kidney health. And those pictures I took from her website. The Qingyang vinegar, the black vinegar. I want you to see that, you know, per tablespoon, you have 110 milligrams on only sodium. So that could be way less and more helpful. And then the bullhead barbecue sauce that has 55 milligrams per serving, per tablespoon. So those can, as I said, can help. Want to move to the phosphorus nutrition label reading. I talked last week about looking for phosphorus additives. Phosphorus is not one of the nutrients that's it's mandatory to be on the nutrition label, so you might not get that in terms of milligrams or percentage, but you'll be able then to look at the ingredient list as the only place where you could see if there are any phosphate additives. Again, you might not know how much phosphorus is in that food. You could check online, because if it's a food that has naturally phosphorus, you can find that information. But at least you'll know if they're phosphate additives or not, which remember I said those are the ones to limit the most. And I have here listed all the names that could basically signal the different types of phosphate additives used in foods. And if you could notice, they all have this phos kind of word in it. So it's easy to, you don't have to remember all those names. It's easy to kind of spot them. I have a few examples here. Like, for example, this is the Safeway brand for pancake and waffle mix. And you could see here under leavening, you have the phosphates, right? Sodium aluminum phosphate and monocalcium phosphate. And what happens very typically, a leavening agent, mainly baking powder in the processed foods, will have phosphates. You know, baking soda, it's sodium bicarbonate. Baking powder is sodium bicarbonate plus an acid, usually cream of tartar, right? In that particular case, if you have a baking powder that's having those ingredients, you don't get the phosphates, versus some of the baking powder or leavening agents labeled on the ingredient list will have the phosphates instead of the cream of tartar, because you need something acidic. With the alkaline baking soda, when you put liquid in, you just kind of activate, you create the bubbles, and that helps with the fermentation and leavening process to create the baked product. But unfortunately, as I said, any kind of, the majority of those mix, if it's a brownie mix or a buttermilk pancake or waffle mix, will have those phosphates added. So I always say it's better to make your own pancakes at home with to skip the phosphate. The same here, Vans or frozen waffles. And I want to mention them because a lot of my patients kind of, I mean, they're healthier in the sense that they are whole grain, they have more fiber, they have little added sugar, are gluten-free, some of them, and perceived more healthy. But again, this baking powder, when they put baking powder, they have to put what kind of baking powder, what would be in it. And then you could see it has sodium acid pyrophosphate, baking soda, and monocalcium phosphate. But this is also a phosphate type of leavening product. So trying for sodium to look more at the ingredient list and limit as much as possible the phosphate additives would be the message here. Now I have some tips for people with sweet tooth, which again was one of the questions that was more prevalent from the audience. I know that is difficult, right? We all love treats, and I don't think there are many people around that won't like desserts or treats in general. So having a sweet tooth is very common. Again, those changes can happen in time. I've had clients that I work with that just cold turkey stop eating sugar, and then it works for a while, but unfortunately sustainability is a big issue to kind of stay off sugar long term, because again, we're humans, we like some treats, and I think it's not realistic to think that for the rest of my life I won't have anything sweet, you know, it's sad in a way. So it's always good to try to work with yourself and find ways to satisfy that sweet tooth in other ways, and limit as much as possible the added sugar. And I want everybody to remember what I said earlier, that sugar feeds the dopamine loop, so it has a little bit this addictive cycle. So the more you have it, the more you want to have it, and you're gonna crave it. So ideally is to, you know, not have it very often, so then you're not craving it as much. So finding replacements, the way I put here, have sometimes a low potassium fruit instead of a dessert. You know, fruits can be wonderful ways of because, you know, they're sweet, and if you like them, they could work sometimes to just curb that sweet tooth. Using moderation sugar alternatives, I put here stevia, monk fruit, doesn't seem to be the ones that at least not recently associated with any possible issues. I know there are a multitude of artificial sweeteners and sugar substitutes, what we call. And again, I would use them in moderation because the research kind of goes back and forth how good those are for us. They can affect our gut microbiome. They're not necessarily the best deal in town to say, yes, instead of having sugar, I'm going to have those sugar, either artificial sweeteners or sugar substitutes. So they could help, especially as you struggle to stay off sugar and not have as often, and you also have diabetes. So they could be of help, but we still want to use it in moderation and not just say if they're sugar-free or calorie-free, that means I could have as much as possible. Find desserts that can be satisfying in smaller portions. And I have an example. I have a client that I've been working with, and she loves chocolate. She's a chocolate lover. And in particular, she was telling me, for example, she loves this chocolate cake at Trader Joe's in the freezer area that she said, if I get that and I get it at home, I buy it and take it home, I'm just gonna, honestly, the whole thing. And it's not, I mean, sometimes I say I'll have just a slice, but it calls my name. It feels like really hard to control that. And she tries not to buy it because of that reason. And but when she really craves the chocolate, there are also those chocolate meringue type of cookies at Trader Joe's that she could have about 2 or 3 of those that won't be, I think that there are 3 in a serving, she told me. And again, sugar is way less, and it satisfies that chocolate cravings. It's fine, and she won't eat more than 3 because they're not as triggering as the chocolate cake. So finding those kind of satisfying desserts that you could consume safely in smaller portions without having to kind of struggle with that. Trying to make your own desserts, right? So then you have more control over the ingredients, especially when you're trying to limit certain things, not just sugar, but other nutrients and protein, and trying to use to make your own desserts your own treats would be a good idea. And there are some healthier alternative for desserts that can, again, sometimes for some people at least, they could be satisfying. It's chia pudding that's made with a milk alternative. I had a woman that she told me she loved apple pies, and she said if I thinly slice the apples, like put them in the microwave, I sprinkle some cinnamon and a little bit of sweetener, and I microwave them for a couple of minutes, I think a minute or a minute and a half. She said just smelled like apple pie. They soften. I could just eat that, and it's very satisfying, even though I mainly eat the apples, right? And something like that worked for her. Can make sometimes, especially for ice cream lovers, you could make homemade fruit popsicles with fruits that are not super high in potassium if you need to manage the potassium and watch the potassium intake. So there can be definitely options that you could use. And then, of course, having some treats that you plan for once or twice a week, you have some real dessert. But instead of having that every day or even multiple times a day, you could use all those alternatives to just not have as much. I have here some, this is from National Kidney Foundation website, different types of milk alternatives. As you probably know, the cow's milk, I mean, in a cup, you get 8 grams of protein, about 230 roughly milligrams of phosphorus, and about 360 milligrams of potassium. As you could see, some milk alternatives also may have that, like soy milk. It's plant-based, so that's the difference here, right? Because we're talking about animal-based versus plant-based, and all our discussion with acid load and how that can be more helpful. But phosphorus, potassium in the plant-based versus animal-based might be less absorbable. But I wanted to point out that certain, you know, like even the oat milk, they're not necessarily lower numbers. We have here the rice milk and the almond milk as the lowest in phosphorus, potassium, and protein, very important. Remember I said with phosphorus, potassium, not everybody needs to be very restrictive. Some people may need to watch and be sometimes a bit more careful, but the protein is something that we want to not overdo. So when I talk about like chia pudding with some milk alternative and again, making your own desserts, I wanted to kind of give you this information to see what would be a good like a good option for a milk alternative if you need to make a dessert. Those that are here not available with an asterisk is that basically they contain some added phosphates, most of them, and then it's harder to estimate. And again, those would be more absorbable. So the recommendation from National Kidney Foundation would be to phosphate binders if prescribed by your doctor when you use those milk alternative products. I wanted to show you, I have a few slides of portion sizes, right? Because we all know they're important. Regardless if you manage your weight or not. If you need to control protein, for example, the CKD patient, you still need to be aware of the portion size. So I started with cheese. 1 ounce of cheese, as I showed you in that, can be somewhere between 5 to 7 grams, usually 7 grams for most cheeses. Sodium can vary quite a bit from a bit lower to higher, depending on the type of cheese, and there's not much potassium and phosphorus, some. So some types of cheese here will have more than 300 milligrams of phosphorus and some will have less than 100 milligram. And lower sodium cheeses will be fresh mozzarella, Swiss cheese, Gruyere, Emmentaler, ricotta, Parmesan, mascarpone, and like a low sodium cottage cheese. Cottage cheese by itself, it's quite high in sodium if you notice, but there are some low sodium options available. So the message here is you need to read the nutrition label, right? Because it can vary. I gave you just some examples of the typical ones that are lower sodium. In 3 ounces of cooked chicken, remember I said the size and the thickness of a deck of cards or the palm of your hand. You have about 21 grams of protein, sodium about 63 milligrams, naturally occurring sodium in chicken, if cooked without salt, right? Just the naturally occurring in chicken, which is very low. And then some potassium and some phosphorus. But overall, I think that's important, the protein here, kind of adjusting the servings based on your protein budget and trying to alternate more with plant-based protein, the way we discussed last week. Half a cup of cooked beans, usually half a cup is the size of your fist, or I say the size of your palm with kind of handful, right? 1 handful up to your fingers. About 7 grams of protein. Again, sodium, 0 milligrams. There's no sodium in beans unless you cook or you have canned beans that have added sodium, which right now there are lots of alternatives with added, which I would recommend. Potassium, it can be between 300 to 475, depending on the beans, and phosphorus between 100 and 140. Remember those potassium and phosphorus both because they're plant-based type of foods, they're not, we're not going to absorb all that. The same with nuts, absorption is less for potassium and phosphorus, 7 grams in 1 ounce of nuts, which is 1/4 of a cup. Here you have how many, like for example, 24 almonds will be in 1/4 of a cup. Brazil nuts only 6 or 8 because they're bigger. So they give you also the number of nuts that would be in 1 ounce. and 7 grams of protein, sodium very little, 0 to 3 milligrams, if no salt added. Some salted nuts, even when you look at the nutrition label, because nuts do not have naturally occurring sodium. Even when you have some salted nuts, when you look at the nutrition label of the package, you'll see that a lot of times the sodium, it's maybe 100 milligrams or even less, or a bit more, 110, but still on a low sodium definition. So it won't be necessary that you have to have unsalted. If your budget allows you to have salted nuts because they're not high sodium by definition in a serving, you could have that. And again, the potassium and phosphorus, they're not highly absorbable because of the phytates and the fiber. I have here a slide to talk about why is meal planning important for people with CKD. Well, because it helps you to be more intentional, right? As you notice with the CKD diet, there are lots of things to kind of watch for, protein, sodium. So by doing more meal planning on a regular basis, you have better control, right? On what you get from all those nutrients. You could then prepare your foods with less sodium. As I mentioned, packaged foods, restaurant eating will actually be about 75% of the sodium. It's coming from those foods, restaurant eating and processed foods, packaged foods. So when you really start cooking more at home, with whole food ingredients, not a lot of packaged foods, as I mentioned, you really cut back significantly on your sodium. Again, it gives you the flexibility to modify your meals that you usually enjoy with some preparation and planning. And planning will help you make better choices. Because I always tell my clients, if you have that component of meal predictability, you know when you're gonna eat, you know what you're gonna eat, how much you're gonna eat, you really don't think that much about food, and you're likely to stick with that, with that decision. And not to say that then you cannot change your mind and get something different, but I give this example when you go to work and pack your lunch, right? You know when your lunch break is, you know what you're gonna eat because that's what you pack. You know how much you're gonna eat because that's what you brought. And there's no, basically your brain doesn't have to decide there's no room for much of a decision that needs to happen, or more impulsivity of, oh, I want this last minute, I changed my mind, I don't want a salad, I want a sandwich. So a lot of times we're more likely to stick with our decision that we made when we were not hungry, right? When we plan the meals and I also tell my clients all the time, try not to, try every day to know what you're going to have that day for lunch and dinners. If it's morning, you have your breakfast, think about what I'm going to have today, lunch and dinner. And the chances are higher to stick with that and to be to be a healthier choice when you think in advance what you're going to have, instead of like waiting last minute when maybe you're hungry, you're might crave more calorie dense or carb dense or high fat foods, or also when you just have to eat because you're hungry and you're running out of time, and then whatever it's easier to get your hands on, that's what you're going to end up eating. The first steps to planning a guinea-friendly diet, like any other healthy diet, would be to try to be intentional about certain things, such as regular grocery shopping day, at least once a week. And you have to kind of have that designated day. For most people, let's say they go on a Friday, or they go all the time on a Saturday, or sometimes you need to go week by week and figure out when I'm going to have time. I need to go this week to shop for food. So having that designated day and not just wait until you run out of things and you don't have anything in the house to eat would be a good idea. See what you have in the in the house, right? Because you want to create a list. You want to kind of go to the store organized and ideally not hungry on an empty stomach. but also organize with a list to kind of know what do I need, what do I want to buy for next week, what I'm going to eat next week. So it helps you kind of think ahead and do some meal planning just by preparing that grocery shopping list. Again, when you do that, see what's in the house, see what you still need or what you still have. Ask other household members for meal ideas. What do you want to eat? What what would be a good thing to get. Be realistic about your time. Foods raw versus cooked versus leftovers, and reuse items for multiple meals. Try batch cooking, freezing extras. All those things are good ideas to help you keep yourself organized. And become an expert at reading the nutrition label. I put here the Mediterranean Dish website. They have really nice recipes, healthy, and they're kind of following the more Mediterranean diet type of pattern. Some tips on behavior change. You want to create realistic and achievable goals. Make sure you start with something small or break a bigger goal into smaller ones. Start with something it's easier to achieve it. Eating more fruits and vegetables. You like them, but you're not in the habit to buy them. This could be, okay, I'll start putting them on my list and buy them more often. It's easy versus I'm snacking in the evening while watching TV. That might be a little bit of more difficult kind of habit to break. Use tools for accountability, working with professional or having friends. I have a client that she has this kind of health challenge with a friend, and they challenge themselves. They keep themselves accountable. You could keep a food journal or use app to track your food and activity. And then I talk about meal planning and meal predictability. Knowing when you're going to eat, what you're going to eat always helps. Keeping a clean food environment at home and work. So guess what? What we buy and bring in the house, that's what we're going to end up eating, because nobody wants to buy things and throw them away and waste their money or waste food. So you're going to end up eating, and you buy that Costco size potato chip bag. You're going to want to finish that. And the chances are, if you were buying a small serving just because you had the craving and then you're done with it, versus that bag, even though you want a portion control, you're still going to eat more often in a month from it because it's going to go stale. And you're going to eat, just going to eat more if you bring more in the house. And then have some planned treats weekly. The way I said, especially with desserts, like treats can be anything. Can be something savory, maybe potato chips that you like, or can be something sweet. Have them weekly, but put a frame. Make it more like I'll treat myself a couple of times a week versus every day you're going to want to have some treats. So make them more special and incorporate them on a weekly basis, because this makes your diet change more sustainable, right? It doesn't feel like you're on a diet. Meal plan of the week. So this is a form that you could use. And then planning a 7-day can be overwhelming. You could begin with 3 days, and then Monday, Wednesday, Friday, come up with some ideas. You make some leftovers, and then next time you could have a whole full week filled out. So if you have, and some people work like that, they like to write down the menu because then they generate a shopping list and it's easier for them. You could totally do that. And then those are some pictures, breakfast ideas, got a toast with some egg or egg muffins, or multigrain cereal like an oatmeal with some nuts and fruits. Lunch can be salad with chicken, or a pasta dish with vegetables, or minestrone soup with beans and veggies, ground beef with vegetable in a pita pocket. Lunch, we have this more plant-based burrito bowl, and this plant-based buckwheat garbanzo salad, beef stir fry when you're trying to, again, limit the protein and put more rice and vegetable, and then a salmon and a salad type of meal. And some snacks. different kinds, tuna and cucumber. Looks very pretty. Nuts, something that maybe you make at home that's not, can be satisfying and not overly sweet. Celery with cream cheese. And I have some recipe sources for kidney friendly, and I think that's about it. So that concludes my presentation, and I'm gonna stop sharing my screen, and we're gonna move into introducing Trisha, our speaker for today, guest speaker. And thank you so much, Trisha. Welcome to our class, last class. We're excited to have you share your story and your kidney story. I know you have a weight loss story to say, and I don't want to give away more from your presentation, but I would like you to introduce yourself and tell us more about your journey as a kidney patient.
Okay. Yes, I have, I got sick found out my kidneys, I had CKD back in 2019, and I've been on dialysis ever since. It's been kind of a long journey. I've also fought my weight all my life. So I've really had to change my lifestyle and change the way I eat and find things that were healthier to eat. I'm on a positive road. I'm working with CPMC to lose weight and hopefully in the near future get a kidney transplant and not be on dialysis, but still be on a kidney-based diet, eat healthy. And I do like she's talking about, I do have a sweet tooth, so I find alternatives for that. I do a lot of fruit. Lately, my newest thing is peanut butter. So I've been eating, I found those rice cakes that are really good with peanut butter on them and things of that nature. Because I'm on dialysis, I really have to limit my fluids. So I'm only allowed 32 ounces of fluids a day. So I have to be careful if I'm doing soups, but I do like to do vegetable soups and things of that nature. I try and do more vegetables than I used to. I'm trying to integrate that into my diet. I do have a pacemaker also, so I have to watch out for things for cardiac health also. But I'm on a good path. I'm losing weight. I am on Wegovy for weight loss, and that's really been helping me. Helps with my appetite because I am a snacker. I like to snack in between meals, and so I've become less of a snacker, and I've been trying to find other things that are healthier to snack on. But I do occasionally have ice cream or or something salty like nuts or things of that nature. But I try and not do it as much as I used to. I try and do it more occasionally. Breakfast, I try and do eggs. I try and do like a turkey sausage that's a little less than the regular sausage. For lunches, I like to do salads. I'm single and I live alone, and I'm not a big cook. I don't really love to cook. So I've found Factor meals. You do them online and you can pick whatever you want. And so I really like them because they have lots of chicken dishes. They always come with a vegetable. They do cauliflower rice instead of potatoes. So it's a good alternative for me because I can do that either for lunch or for dinner. And I feel like I'm eating something healthy. I limit I don't do restaurants a lot, but if I do go to a restaurant, I try and really look at the menu and find something that's healthy like fish or chicken. I try and stay away from stuff that's real greasy. I've noticed with CKD, I also have I get a little more heartburn than I used to, so I have to really be careful. I can't do a lot of spicy things anymore. I have to be careful of sauces and things of that nature. But yeah, I've had to change my lifestyle because this isn't just a diet that I'm on until I get a kidney. I have to change my life. And also because I want to keep my weight down also because I'm not diabetic, but I don't want that to enter into my life. So I really try to limit the things that might be sugary or salty. I watch my sodium, that I don't do a lot of sodium. We took salt, my family, we took salt off the table probably 30 years ago. So I don't put any extra salt on anything. I do a lot more pepper than I do salt. So I'm not sure what else you want me to go over, but that's kind of my story.
Yeah,
Kind of,
no, it looks like great and a lot of changes, wonderful
yes.
changes you made with your diet. And it also looks like you have, like, what's the time frame you made all those changes? Because I want people to kind of know that they don't happen overnight, right? Like
No,
everything
no.
happens in a sequence. Yeah.
Yeah. When I got sick, I was really heavy. And so I had to, start to change. I didn't, to be perfectly honest, it's probably been in the last year and a half or so that I've really tried to be better. I'm a food person. I love food. So I'm never going to be perfect. There's always going to be things I'm going to want to have or crave, And I've been told by many people that, if you're craving something, have it, because if you don't, then you're going to crave it even more. And, sugar for me is too. If I have sugar, I want more sugar. So I kind of do things, my sister's gluten-free. So she does a lot of things gluten-free, and she has a hard time with sugar also. So we try and find in desserts and things that we make to use substitutes that aren't real, or things that aren't real sugary, or do something that's a little more savory, or try and find things that aren't gonna keep you wanting sugar. So like sodas, I don't drink sodas at all. Well, once in a blue moon, I'll have a Sprite, but I'm not a soda. I was a soda drinker, and I don't do sodas. I don't do any carbonation, even though I like it. I do more like lemonades or iced teas. I do water, to just because I want something that tastes good. So I try and do different kinds of like iced teas and things like that, and that will crave my appetite for those things. But it hasn't been something I did just, flip of a switch. It's been something I've really worked on and tried to be better at. But like I said, I'm not perfect. I fall off the wagon once in a while, once in a while.
Yes, but that's the reality, and
Yeah,
it's
it
good to
is.
know
Yeah.
that nobody has that perfect diet
No.
every single meal, and it's good to try to stay on a pattern and focus on what you can do most of the time, and don't worry
Yeah.
that much about the exceptions, the cheat days, the things that may happen still, right?
Right. Yeah.
And it's good to kind of be aware of that and kind of accept that, right? And
Correct.
keeps you on track. And the way I also said, have some treats, right, that you allow yourself to have, so it's more a
Yeah.
sustainable diet approach.
The
Would
one
you mind
thing
if you share? Yes.
the one thing that has also helped me is my dad's diabetic. And so he was taught, one of his dietitians told him that when you eat, like eat and then put your fork down and take time to eat slower, because I'm a fast eater. So I've been trying to do that. And the other thing I've really tried to do is once I'm full, I'm done. I don't keep eating. Like I just push my plate away and okay, I'm full, I'm good. Because I've noticed that's really helped also, because my appetite isn't what it used to be. I've noticed with taking the Wegovy that my appetite isn't as I'm not as hungry as I used to be. But if I stop when I'm full, that really helps. So
Yeah.
that's a good tip. Those are a couple of good tips.
Yeah, that's what a lot of my patients say, that it kind of quiets that food noise, and
Yeah.
you're not thinking about food all the time. You're not,
Yes.
having that hunger all day long. So that helps a lot. I wanted to hear a bit more also about some challenges you've had. I know sometimes people love to hear all the things that work, but I know there are always challenges, right, with any journey. So if you can share, one or two challenges you've had, and how you kind of work around that.
Well, in the beginning, the fluids was a challenge because I used to drink a ton of water. I mean, I would drink 8 to 10 glasses of water a day, and I can't do that anymore. So I really struggled with that in the beginning. But I found different things. I found like these mints that I really like, and that will help like make me, if I do the mint, I won't be as thirsty. Or I found some sugar-free candies, different like, and that would help because it would like create saliva in your mouth so you're not so dehydrated or feel so thirsty. And those things really helped me. And I just I had to gradually limit back my water. Now I'm fine with the 32 ounces. I don't have a problem with it, but it took me a while to get there. And I think part of it was that, I never knew really what phosphorus was or these different things when I first got sick. I didn't know what that was. So trying to learn that and, what's in what foods have phosphorus and things of that nature, and really try to bump up the fruits and vegetables, which I didn't do a lot of before. So, and it's to this day I struggle with that, because it's how do I figure that out? And like you said that it's a good thing to plan ahead. And I totally agree with that. I have to plan ahead for things, because if I don't, I will eat something that maybe has more, I really look at sodium on things. When I buy stuff, I really look at sodium, but I sometimes don't look at the other stuff. And so sometimes I have to really kind of pivot as to what did I buy and how do I do that being by myself, because I don't want to spend a lot of time in the kitchen. So trying to find things that are easy, simple for me to do has been a challenge, but I'm better at it now than I was before. Let's put it that way.
Yeah, no, you're right. It's a steep learning curve, and that's why having like a class like that to give the tips and the information that people need, also having more resources. You found that meal delivery, that system that
Yes.
works for you. And what's nice with most of them is that you can try different things, but you can see on their website the nutrition information. So
Yes,
you
yes.
have that, how much protein, how much potassium, phosphorus, sodium, all those things that some people may need to look for. So that's nice, and it's a good option for people that don't like to
Yeah.
cook.
And you can order like you can order, 4 meals, 6 meals, 8, you can order however many you want, and you can change it up anytime you want. So if you think, oh, I'm going somewhere this week, I only need 4 meals. You can do it weekly. You can do it every other week. You can change up when you get them. So, which is nice for me, because sometimes I want to have one, sometimes I want to have salad, both dinner and lunch, or whatever it happens to be. So, they come and they're not frozen. They come cold, and you just put them in your refrigerator, and then you take them out, you put them in the microwave for about 2.5 minutes, sometimes a little longer, just depends. And I have not found one that I didn't like. They're all really, really good. So I've really enjoyed them. Dr. Patel, my weight management doctor, is the one that told me about them, and they're great, because I've tried other stuff and I like these the best.
Yeah, that's good. Yeah, so thank you, Trisha, for sharing your story with our audience today. I want to kind
Sure.
of see if anybody has specific questions for Trisha they would like to ask. You could put it in the chat box, or you could also raise your hand and talk. Lily will help you with that. But if we have any specific questions for Trisha, we'll take maybe a minute to
Yeah, thanks, Elena, and thank you, Trisha. That was great.
Sure.
We did get a question in the Q&A. Where'd it go? Oh, here we go. How has your experience with CKD on Wegovy been? Can you talk a little bit more about that?
On what? I'm sorry, say that again.
Yeah, how has your experience on Wegovy?
Wegovy, okay. It's been really good. In the beginning, I had some stomach issues. My stomach was just a little off, and it lasted for about, maybe like a week and a half. But then as I've done it for almost 2 months now. I was doing Zepbound before, but it was on a back order, so now I'm on Wegovy. And but since then, since that all kind of settled down, I haven't had a lot of stomach issues. So it's been going good. I noticed that I am less hungry, and it's not hard to do. You just do an injection every week, and I found it to be really good. Yeah, I found it to be helpful for me, because I'm a snacker and I don't snack as much as I used to, which is really good. So yeah, I think it's a positive thing. Both Zepbound and Wegovy, they're both, to me, when I started Zepbound, I had some of the stomach issues, but it, went away after, first week or so. So same. But I'm on dialysis also, and sometimes I have stomach issues with dialysis. So it could have been a combination of both.
Got it. Great. Thank you for sharing.
Sure.
That was the question we had in the Q&A. Let me just double check to see if anything else came in.
Sure.
I just want to, there was a question asking about the food service, and I know, Trisha, that you had said Factor. So I put the link in the QA answer.
Okay.
Yeah, because I've actually ordered from there before.
Yeah.
So I'm a little bit familiar with them. Yeah.
Yeah, it's really good. And
Yeah.
it has different kinds of options, because I'm there are certain vegetables I don't really care for. But they come separate, like the meal comes in one side and the vegetables in the other side. So I might get something and just not, and maybe make myself some vegetables instead of that. Cause I buy a lot of I do some of the bird's eye frozen vegetables from Walmart, because you can microwave them. And I like that because then I can eat half for one meal, put it in the refrigerator, and have half with another meal. And that works out really good for me since it's just me eating, So I'll do cauliflower or broccoli or zucchini, something like that, because it's easy for me. I also have an air fryer. It's new, so I'm just starting to try out some stuff with the air fryer, and that works out really good too. So I'm just trying new things. It's not easy for me, but I'm trying to be better at trying new stuff, and the factor meals have been great.
Oh, that's awesome.
Yeah.
That's wonderful. Yeah. So, Lily, if we don't have more questions for Trisha, do you think we should, I know we're a bit late with I think the presentation took a little bit longer than I expected. It's hard for me not to go in more details when I talk about meal planning or behavior change, but if there's no more questions for Trisha, maybe we could continue with the questions for me.
We can go ahead and jump into the Q&A portion. So the first question I have here is, can an alkaline diet reduce potential renal acid load in CKD patients?
So eating more alkaline foods, which are plant-based foods, that's kind of what it's been shown that can decrease the acid load in the urine, on the kidneys, because with more plant-based foods, we create a more alkaline urine versus more animal-based foods can create more acidic urine. So, but it's good to know that and not get into details. Sometimes there's some misinformation about alkaline diets, but basically plant-based foods create an alkaline urine, and that can help reducing acid load on the kidneys. So that would be the answer.
Thanks, Elena. Okay, next question. How good are eggs, for example, hard-boiled eggs, etc., for a kidney healthy diet, and how many are okay to eat per day? Also, is there a nutritional difference between white chicken eggs and brown chicken eggs?
No nutrition difference. And then eggs are good, lean type of proteins that are low in saturated fat. They have more dietary cholesterol, but for people with high cholesterol or heart disease, historically we said we need to limit them because dietary cholesterol is normal to translate into high cholesterol in your blood. But then after 30 years of research kind of established that dietary cholesterol does not really impact as much as we thought our blood cholesterol, that bad LDL. So eggs are back in the favor in a way. One egg a day, even for people with high cholesterol, is considered appropriate and okay. Now with CKD, again, they're low in potassium, lower in phosphorus, but they're a protein food and animal protein. So I would still limit to one a day. It's 7 grams of protein in an egg, and if your budget it's low and it's an animal product, so if you want also do more than 50% plant-based, I would say one a day would be what I would, no more than one a day I would recommend.
Great, thanks, Elena. And I think we've talked a little bit about this last week as well, but can you talk a little bit about how to manage calcium oxalate intake?
Yeah, so, well, for people that have issues with producing, making those kidney stones that are oxalate calcium based, so it's very important to drink plenty of water. You want to be aware of the high oxalate foods and not eat a lot of them, right? You could still have them in your diet because a lot of foods will have oxalate actually, but it's even more important to try to have some calcium foods at the same meal, because they've been shown that the calcium will bind oxalate and you're not really, again, absorbing all those oxalates from the foods that are having more. So, for example, spinach, it's one of the high oxalate food. Having spinach with some like a spinach salad with some goat cheese would be an ideal way, right, to have that, to pair the calcium with oxalate. Now, there's also like cooked spinach will have more versus the raw spinach, right? Because you're thinking about spinach shrinks quite a bit. So you could start with a bag of spinach. If you cook it, you kind of end up with a little bit of cooked spinach. So being mindful and having it more in a raw option versus cooked would also limit how much oxalate you get from that. So those are certain things that I would say. But how you balance it is like, as a CKD, if you have CKD also, like you still want to do a more plant-based, low-protein diet. But as I mentioned, those high oxalate foods, you want to be aware of them and not overdo them, not have high concentrated amounts. When you have those, keep them to a serving, pair them with calcium-rich foods at the same meal as a way to bind that oxalate. And drink plenty of water too. Avoid taking supplements of vitamin C would be also important if you have, as a way to just kind of lower the risk of the oxalate kidney stones.
Great. Thanks, Elena. I'm actually going to jump down since you mentioned supplementing vitamin C. We did have another question that was submitted today. Is vitamin C supplementation still a concern in renal disease? It was previously stated that there may be a risk of oxalate stone formation, but initial guidelines no longer seem to recommend restrictions, especially for chronic conditions like malnutrition or wounds.
Yeah, I mean, as far as I know, you still want to avoid taking a vitamin C supplement if you have the oxalate issue. I mean, there might be cases in which, in general, I say most people, if they have a good diet, they don't necessarily need a vitamin C supplement. They can get it because there are plenty of fruits and vegetables and foods that will have vitamin C. But it might be cases like, yeah, for wound healing and things that you might have to supplement. So from what I know, that this is still kind of the recommendation to not have vitamin C supplements. So I might need to just double check that, especially if it's something newer.
Great. Thanks, Elena. Next question. How can one encourage healthy eating in a family member who is resistant to advice?
Yeah, that's a difficult one. And I know, I had my struggles as a dietitian too, and I have someone in my office that comes with a family member. Usually at the appointment, you could see the patient himself or herself is not really ready to make changes. And, I learned that basically no matter how much I would like for them to make diet changes, or their significant others or family members, it really still boils down to what the patient wants for themselves. And it is difficult, right? It's difficult because the change needs to kind of be embraced, not forced upon. Doesn't really work very well when that happens, right? So a lot of times is, it might be making something or trying to bring in the house certain foods, and in a way trying to increase the exposure to. How I work with patients that are not ready to make change, I kind of meet them where they are, and I appreciate the fact that they tell me, I don't want to change my diet, but I don't want to get diabetes and I'm pre-diabetic. For example, I had people saying that, but I don't want to change my diet. I want to keep eating what I'm eating. So I'm really trying to work with them. I do a lot of motivation interviewing, kind of making them like reflect back to, because it's usually a disconnect between what they want to eat versus what would be good to eat for their health. And then trying to, with a lot of discussion and exploring, to close that gap. And at one point I've seen that after appointments, like if you meet people where they are and not try to say you should do this because that's what it's good and I'm telling you this is good for you, if you kind of try to work with them and acknowledge that it's tough to change, and just kind of listen and help them realize they need to make that change, actually it takes longer, but things actually click, and I see that gap reducing, and then the behavior change happens. Again, it's not an easy process. It's not like something that you would have a magic wand and switch people's brain, but I think understanding, listening, and not trying to force that change upon someone would be more effective than anything.
Can I chime in for a second?
Yes.
Because when I first got sick and I was told I had to go to dialysis, I was, well, my parents could say what I was. I was I had a really hard time. I couldn't talk about the fact that I had kidney disease. I couldn't talk about I couldn't talk about any of it because it was just, I didn't want to go. I didn't want to do this, but I had to, because if I didn't, I wouldn't be here right now. And my weight is the same thing. You know, everybody's telling me what I had to do and how I had to do it. And I'm the type of person that if you tell me I have to do something, I will go the opposite direction. So I had to kind of figure it out for myself. And I had to kind of find a way that was, well, I have to go to dialysis, so I'm going to go. And I had to find a way to be positive about it. And I have to lose weight, because if I don't lose weight, I can't get a transplant. And if I can't get a transplant, I'm on dialysis for the rest of my life. And I have things I want to do in my life. So I kind of had to find a way, without people telling me what to do, figure it out for myself to get there. And it took me quite a while to get there. But, you know, when I did, then it was like I kind of inch by inch was able to do things positively and change my diet and change the things I did. I mean, I'm 58 years old. I fought my weight all my life. So, you know, it's not something that I learned to do, you know, and just, like you said, flip the switch. With dialysis, I've been in dialysis for 4 years, you know, and now I'm getting closer to a transplant, but it's hard to do. And as human beings, we don't want to be told what to do. And so
Yeah.
I think sometimes if you can find it, your family helps you and they're confident and they're loving and they're positive, they can help you kind of get there. And that's, for me, that's how, but I had to find out I had to get there myself. No one's going to do it for me. I have to do it for me. So that's just kind of my take. So
Thank you. Yes, I totally agree. I think it's in a more supportive, loving, understanding way you can help people versus you just have to do it. Because a lot of us have this, like, you rebel against somebody telling you what to do. Yeah.
Thank you.
You're welcome.
Thank you, Trisha.
Thank
That
you.
was great. And thank you, Elena. I know we're at time now. It wraps up our Q&A for today. Again, I'm sorry if we didn't get to your question. I know there's not enough time in these presentations to cover everything, but we will likely do this presentation again next year, hopefully. And just wanted to, again, thank Elena for taking the time out of your busy schedule to present for all 3 weeks of this series. And thank you to National Kidney Foundation for making this presentation series possible and helping us coordinate. And then thank you, of course, to all of you for joining us and attending these presentations. I will, of course, send the recording for this presentation in the post-event email. And then, like I mentioned prior, there is that post-event survey that will pop up on your screen at the end when you close the Zoom. You can fill out that survey, and if you enter your email address there, a copy of the presentation slides for today will be emailed to you. I hope everyone has a great evening and a nice holiday weekend.
Thank you. Thank you, everyone.